Today, we are focusing increasingly on precursor disease, and that is because we now understand that every person with myeloma once had precursor disease. And the more we learn, the more we understand that we don't know. The biological uncertainties about precursor disease only lead to more clinical uncertainties and, importantly, by implication, also psychological uncertainties on the part of the patient. So we start with biological uncertainties. Today we know so much about the genomic makeup of smoldering myeloma. We know that it in its basic framework resembles multiple myeloma, but there are key driver events like DNA damage pathways, the RAS pathway, also increasing mutations, mutational signatures like ApoBec and copy number and structural changes. What we don't know is why these happen, what the time frame of the acquisition of these genomic events is, and how we can track and time them so we can time our interventions. We also understand so much more about the immune system, about immune changes in patients already happening at the MGUS stage and seen at the precursor stage at smoldering myeloma, and then increasingly in multiple myeloma. What we don't understand is how the genomic and immunological changes interact, and really how our risk models can predict progression at the individual patient's level. So we have several risk models, but these are all based largely on static parameters, and we really need a dynamic model which could help us track the trajectories of disease evolution. So the Pangea model is a dynamic model, and our COSMOS study is a prospective study in the UK for smoldering patients. And what COSMOS is trying to, what we are trying to do in COSMOS is to understand the sequential and longitudinal changes in patients' immune system alongside their genomic changes as well as clinical and biological parameters. Psychologically, of course, there is great uncertainty for people with smoldering myeloma. They want to know whether they will ever progress, and if they understand that they have high risk, they need to understand if this will be tomorrow, next week, or whether they have 6 months before they can start thinking about entering a trial or undertaking treatment. And the prospect of treatment brings again more uncertainties. We don't know what our appropriate goals are or outcome measures, and importantly, patients are not sure what to expect. The uncertainties about whether they will be cured, what the toxicities will be, and what their lives will be when they receive treatment. Finally, if despite treatment, patients progress to multiple myeloma, they want to know that they will still be able to receive the treatments that are standard of care and best practice, and that having been treated at smoldering level does not preclude them from receiving the best standard of care when they progress to multiple myeloma. So I have listed a whole heap of uncertainties, but there is much progress, and we are learning all the time how to integrate our genomic and immunological factors, and also how to design the best trials to help us figure out how to intercept pre-malignant disease for multiple myeloma.